Hi, I'm Darren Spevick, Managing Partner of Eventum Partners. We're a leading executive recruitment company in the digital health and life science sector. This morning we're here with Pierre van Weperen, Managing Director of Ashfield Commercial and Patient Solutions. Welcome, Pierre.
Thank you, Darren.
So Pierre, over the last few years we've seen a rise in the number of digital health companies bringing new products and services to the market. Once they've proved concept in one or two CCGs, their biggest challenge is how to roll out nationally. How could Ashfield help digital companies to achieve this?
Yeah, that's a very interesting challenge. We've done some of these things with smaller pharma companies and animal health pharma companies. And the question always is, you don't necessarily want to dress up a whole big organization. If you're starting from small, you have access in one or two CCGs. And that's where we come in, because we can build exactly what you need towards those one or two CCGs, build from there, and look at what the flexibility is and that the agility that you need in there to build exactly what you need.
Okay, thank you. What are the benefits of partnering with a CSO organisation like Ashfield rather than recruiting directly or partnering with a pharma or medtech company?
One of the things you see, the NHS changes quickly. The NHS moves quickly. Formulary access, non-formulary access. You need two things. You need potentially hotspots approaches, where you just go where you actually have access and build from there. But you also need flexibility. You also need speed. You also need agility. And that's where we come in. We can do that very much better than the traditional, or even if you would hire the people to your own headcount, where you have limitations around that. We can do that, and that's the benefit of working with us.
So what type of people and skills can Ashfield provide to such companies? Don't you mainly provide pharmaceutical sales representatives?
We did start as mainly pharmaceutical representatives, and that is still our core business. But over the last 5, 6, 7 years, we've built loads of different capabilities. We have a remote contact center. We also have nurses. So we have reps, we have nurses, we have MSLs, medical science liaisons. And what we do is we have the conversation with the client to look at what it is they need. And if it is promotion, then that's that. If patients or health care providers need to be educated, we bring in the nurses, or they bring in the MSLs to do it. So it's the variety and the spectrum of services that we offer.
Okay. So many of these digital health companies might be early stage or have limited funds compared to big pharma. So are Ashfield able to offer solutions to support these companies, particularly in their early days?
Funding is an important point. And again, that goes back to, you don't want to have a big organization from the start, because that involves a lot of money. If you start targeted with the organization that you need, it suddenly also becomes a lot cheaper. So we by building that bespoke solution, we can also limit your expenses.
So if a digital health company was considering partnering with a CSO like Ashfield, which they may not have done before, what would be the one thing they should really consider in order to get the most out of that relationship?
The word I would probably use is openness. The better we understand what it is you need, what you're trying to do, what the 3, 4, 5 year plan is, the better we can build and challenge each other in that conversation to make sure that you get exactly what you need and deliver on that.
Wonderful. Thank you, Pierre, for sharing your insights on why and how a digital health company should consider a CSO like Ashfield as a commercial partner.
Thank you, Darren.
Thank you.